Hello and welcome. This is Brittany Chavez, and I am going to discuss with you today the topic of induction. And I'm really excited to kind of really jump into the meat and bones of this topic because I believe that induction increases your overall risk and that it might even decrease your quality of life. Now, I understand there are some medical indications for induction. This video is not about a medically necessitated induction. If your care provider is suggesting that you get an induction, my advice to you would be to ask your provider what happens if you don't get the induction, and to look at research and kind of do your own research for your own unique situation. So there are, like I said, some risk factors that do necessitate an induction. So if pregnancy is no longer safe for you or the baby to continue, then induction is the best choice for you. But unfortunately, what I've seen as a doula in the past 5 years is that induction is often used as an elective procedure, and it's often used when it's not necessary. And so this presentation is about the unnecessary inductions and the risks that you open yourself up to when you get an induction and it's not necessitated. So when I began doing research on this topic, I kept coming across this newer study called the ARRIVE study. And man, I was just so taken aback because all of this research, which seemed really solid research and everybody was talking about it, it seemed like it was better for people to get induced at 39 weeks because the study found that elective inductions would decrease the instance or the risk of having a cesarean section. So when you initially read that, that sounds like a really great idea. It sounds like, well, yeah, every time everybody reaches 39 weeks of pregnancy, then we'll just hurry up, quick, do the induction, and we'll decrease cesareans and we'll improve birth outcomes. But unfortunately, it's not that simple. And so I'm glad that I looked more into this, especially this ARRIVE study, to kind of see how they arrived at this conclusion and kind of where they were coming from. So when I looked at this study, I was thinking to myself, I'm studying to be a midwife. I am wasting my time. Like, why am I going to waste my time being a midwife? Midwives don't use medical methods of induction. And if it's truly better for people to be induced at 39 weeks, and there's no point to me even continuing my study as a midwife. I just thought right then and there I should give up and apply for medical school. And when I looked into this more, I found that 73% of the people who were asked to participate in the study did not want to participate. So what this tells me is that overall, the researchers who gathered data on this study, they were hard pressed to even find research candidates. So generally speaking, people as a large wouldn't participate in the study, meaning that large scale general population, people don't want to be induced. People are pretty informed, generally speaking, and they know the risks of induction. They know what it's going to do to the body, and they say, that is not for me. I am not going to sign up to be a research participant and to automatically get induced at 39 weeks. So that's very interesting. I think that when we gather research and data, that we also need to take into account not just what our research and data tells us, but how people feel, because there has to be a humanistic element to medical care and to research. We can't simply do things because they sound like a good idea in theory. We have to be able to do things like inductions or like any kind of medical intervention or medical treatment for that matter. And we have to be able to do that in a way that is honoring to our patients and to our clients. So the other really important detail that's often overlooked in this study is the providers. So in this study, the doctors who participated in data collection and patient care knew about the study. So they knew which of their patients were ARRIVE participants and which of their patients were not. So when we look at data collection, especially for research and studies, it's very important that studies are double blind. And what that means is it means that neither the participants nor the caregivers know who's a participant of the study. In this way, there's no manipulation of the research, of the data that is collected. So in other words, the providers in this study might have been less likely to do a cesarean section on their ARRIVE clients and patients because they knew which patients were being studied, and therefore that predisposes the doctors who participated in this study to manipulating the study data. I also wanted to add that I found plenty of research that details data from midwives and the low rate of cesarean sections that midwives have for their clients. Additionally, like I said before, midwives, especially in an out-of-hospital setting, they don't use medical inductions. So what's going on with that? How come there's this really big kind of inconsistency in research between doctors and midwives, and more conclusively, there's a big difference between the ARRIVE study and the research and data that midwives have. So I also found a lot of induction evidence that says if you are induced, you are twice as likely to get an epidural. So this is kind of the quality of life stuff that I was talking about on the first slide. Current research and evidence shows that epidurals don't increase your risk of perineal trauma, but they do increase the risk of your need for operative delivery. So I know this piece of evidence up here, this is old. This is from 1999. But this study says that operative delivery increases risk of perineal trauma. So, I mean, I needed to include that. This is a very simple conclusion to draw, that if you have an operative delivery, it increases your risk of perineal trauma. But I wanted to also present that data for you to show that this has actually been proved by science, by research, by data collection. So if you have an epidural, you're more likely to have perineal trauma because you're more likely to have an operative delivery. And so for anybody watching this who's not quite sure what an operative delivery is, UpToDate.com defines operative delivery as a delivery in which the operator or obstetrician uses forceps, a vacuum, or any other device to extract the fetus from the vagina with or without the assistance of maternal pushing. So this is like the use of vacuum, forceps, and all of that interesting jazz. These tools and this method of assistance can cause fetal morbidities. So an operative delivery, not only does it increase the risk of perineal trauma for the person giving birth, but it also increases morbidities for babies. So babies can have things like scalp lacerations, like cuts on the scalp, hematomas, which are like really bad bruises, hematomas in the eyes, intracranial bleeding, facial nerve palsy, or even paralysis. And a lot of other risks. A lot of people don't know this unless they study like obstetrics and they're a super big birth nerd like me. But Sylvester Stallone, the famous actor, Rocky guy, he was delivered via forceps, and half of his face is actually damaged from the forceps. So that man has a birth injury. He has one of these morbidities that I'm talking about that are associated with operative delivery. Then, of course, 19% of people who have perineal trauma are going to have a significant decrease in quality of life. So this means that they will have urinary issues, they will have incontinence issues. And so these things really, they're going to affect the way that you live after you give birth. And so I do want to be real with this study and to tell you that I think the 19% of women who have perineal issues or perineal trauma and urinary issues, I think that's a greatly underrepresented number, because I think a lot of people, especially in America, do not have proper access to medical care. And I don't think that a lot of people even report their incontinence or perineal issues or sexual dysfunction or any kind of problems that they might have post-birth. A lot of people, especially women, chalk it up to just being normal after you have a baby. And so what I'm telling you here, my case that I'm trying to make is I think that induction especially decreases our quality of life. And of course, what we're seeing right here with this data, with this evidence that is presented, is that this can increase your perineal trauma and increase the instance of you having urinary issues. So this might mean that, you need to take PT, like physical therapy later in life, or perhaps you might even need some sort of surgery to fix these incontinence or trauma issues. Additionally, I wanted to talk about Pitocin. I have a whole another video that details Pitocin and kind of the risk factors and complications that you might encounter if you use Pitocin, and that link is in the description below, so be sure to check that out if you're interested. This is just a really small overview of some of those interesting things that I found that are in that video. And so I especially decided it was a good idea to go over this type of information about Pitocin because most of the participants in the ARRIVE study specifically that we talked about in the second slide, they had Pitocin. And I forget what the exact amount is, but most people in America who go to the hospital to have a baby will end up having Pitocin. I think the number is like 80% or something, but be sure to check that other video below to make sure that you get that accurate information. But when you are given Pitocin, there's a possibility of risks and negative complications. So children who are on the autism spectrum are 2.3 times more likely to have been born from an induction. So I think that that bit of research and evidence is really interesting. And we don't know, like, we just don't know what causes autism. We don't know if it's something that's developmental or evolutionary. We don't know if it's something that is caused by medications or toxins in the environment. All that we know is we have a lot of this data, and a lot of this data shows overlap between disturbances in the birth processes and disturbances in our environment and pollution and that kind of thing to raise the instance of autism. So like I said, while we don't know for sure that that Pitocin itself causes autism, children, like I said, are more likely to have undergone induction if they have autism. The truth is we just don't know about autism. We just don't know how it's caused. And so I think this information is very interesting. So while this information doesn't give us like, it doesn't point fingers at Pitocin and say specifically that Pitocin causes autism, it's another connection that we've drawn, that we've seen, that people who have autism, they're more likely to have been born from an induction. Also, this is very interesting. Pitocin can increase your risk of postpartum hemorrhage by 3 to 6%, meaning that people who had Pitocin at birth were 3 to 6 times more likely to have a postpartum hemorrhage than people who did not receive Pitocin. And I think that this is very interesting because we do use Pitocin as an anti-hemorrhagic. So if you're hemorrhaging at a birth, a lot of times midwives carry Pitocin. And of course, in the hospitals, they have access to all kinds of different medicines like Pitocin and Metrogen to help you if you are bleeding. But what this piece of research shows is that if you receive Pitocin during pregnancy and labor, that it did increase your overall risk of hemorrhaging after the birth. So I think that that's interesting to know, and I think it's worth noting, and it's worth talking about. It's worth bringing to the conversation so that we can understand that there are risk factors to taking Pitocin. There are risk factors to induction, and I just feel like this information needs to be shared so that we can have this discussion of risk and we can have this discussion of informed consent. I strongly believe that if people do not know their options and do not know their risks, that there is no informed consent. So in order to have proper consent, people need to know about these risk factors. And then the final piece of evidence or data that I wanted to present to you here, this is something that until I started researching Pitocin, I had never heard about this. And so Pitocin increases your risk of a postpartum mood disorder by 32 to 36%. That is absolutely exponential. And again, I feel like this is primarily a women's health issue where postpartum mood disorders, postpartum depression, postpartum rage, postpartum anxiety, these things are already not talked about. And I did not know, even as a birth worker who's been in this industry for a while, I did not know that Pitocin increases your risk of having a postpartum mood disorder. So while I think that this is postpartum mood disorders are a huge issue in our society as it is. I don't feel like after you have a baby, there's enough follow-up for you. I don't feel like there's enough mental health check-in. I don't feel like there's enough support for people who have just given birth. And so I think that our society already predisposes us to have postpartum mood disorders. But now this newer evidence that just came out in 2017 is showing us that Pitocin actually increases the risk of having those postpartum mood disorders for whatever reason. And again, this is something that needs to be brought to the table, and you need to understand this to have proper consent to understand the risks of Pitocin. So Pitocin can increase your risk of postpartum mood disorders. And then the final thought that I wanted to, really quick leave you with is that the ARRIVE study is not consistent with other scientific findings. So I looked at this comprehensive review, and in this review of data, the source says that the results of their widespread study did not support the use of routine induction prior to post-term. And so in this collection of data, they describe post-term as 41 weeks of pregnancy plus 6 days. So again, this kind of talks about how induction is not necessary and it's not worth the risk unless there is a health problem to you or to your baby, unless you are post-dates. And so post-dates is not 39 weeks. Post-dates is not 40 weeks when your due date is. Post-dates is actually 41 weeks of pregnancy and 6 days. And I just want to throw this out there that the average gestation of pregnancy is for a first-time mom is 41 weeks and 3 days. So I think that that's very interesting to know that if left alone, pregnancy can continue safely well past your estimated due date, and that induction can decrease your quality of life. And there's a lot of risk factors with induction and with Pitocin. So I hope that this small presentation gave you a little bit of overview into induction. And here, very quickly, I just wanted to share with you my resources. I will set these in the description as well. But let me know what you think about this video. Were you induced? Have you ever had to walk through induction with a family member or a client? And what other types of videos or presentations would you like to see from me in the future? Again, thanks for watching, and be sure to subscribe so you guys don't miss another video.